Have you ever wondered how intranasal drug administration works? If so, you're not alone. This method of delivering medication, which involves administering drugs directly into the nasal cavity, is growing in popularity due to its convenience, effectiveness, and the rapid absorption of drugs into the systemic circulation. So, how does it work exactly? It's fairly straightforward. The drug is absorbed through the nasal epithelium, which is the mucus-secreting tissue lining the nose, into the surrounding blood vessels. Depending on the drug's molecular weight, lipophilicity, and other physicochemical properties, it can either enter the systemic circulation or move directly to adjacent areas such as the brain. There are several advantages to this method of drug delivery. Firstly, the nasal cavity has a rich vascular supply, allowing for quick absorption of drugs into the bloodstream. This often results in a faster onset of effects compared to oral administration. Secondly, drugs administered intranasally bypass the gastrointestinal tract and liver, reducing the first-pass metabolism. This often results in a higher bioavailability of the drug. Thirdly, intranasal administration is non-invasive and user-friendly, making it an ideal option for patients who have difficulty swallowing pills or for situations where an intravenous injection is not feasible. Finally, it's a viable option for drugs that require chronic administration, especially for conditions related to the central nervous system, as it can facilitate drug delivery to the brain. Intranasal drug administration is commonly used for pain management, hormone replacement, vaccination, treating neurological disorders, and as rescue medications. However, it's important to note that there are certain formulation considerations that must be taken into account. For instance, optimal absorption requires particle sizes suitable for deposition in the nasal cavity without provoking irritation or being expelled. The formulation's viscosity and the volume administered need to be carefully controlled to ensure that the drug remains in the nasal cavity long enough to be absorbed without causing discomfort. Despite these benefits, intranasal drug administration does have its limitations. For example, some drugs can irritate the nasal mucosa, especially with long-term use. The nasal cavity can only accommodate small volumes, limiting the dose that can be administered. And factors like nasal congestion or the presence of nasal mucosa diseases can affect drug absorption. In conclusion, intranasal drug delivery is an innovative and practical route that holds promise for improving therapeutic outcomes, enhancing patient compliance, and expanding the pharmacological options available for various medical conditions. So, next time you see a nasal spray or similar product, you'll know exactly how it works.